Good afternoon, everyone. Good morning, good evening, from any time you are watching this video. I remain your pharmacy technician, Joe. So today we'll be talking on anti-malaria drugs, and today's video is with conjunction with let me call him my pharmaceutical father, Professor Pharmacist Ayo Olushola. Now let's do a brief introduction. Malaria is the most important parasitic disease of humans and causes hundreds and millions of illnesses per year. So malaria is a very common illness, you know that. So we have 6 major species of the plasmodium of malaria. So we have 4 species of plasmodium, typically human malaria. We have the plasmodium falciparum, plasmodium vivax, plasmodium malaria, and plasmodium ovale. And the 5th species is the plasmodium knowlesi, and it's a primary pathogen of monkeys. The plasmodium falciparum is responsible for the majority of serious complications and death, and is also associated with therapeutic problems. There are a lot of heroes, legends that died as a result of malaria. One of them is Julius Caesar. And because of not wanting the slide to be lengthy, I'll try to be fast as much as possible. Just like this. List of drugs used in malaria. We have chloroquine, amodiaquine, artemisinin and its derivatives, quinine and quinidine, mefloquine, primaquine, atovaquone, inhibitors of folate synthesis. We have antibiotics. We have alufantrin and lumefantrine. But for the sake of this study, we'll only be picking chloroquine and artemisinin and its derivatives. So, chloroquine is actually used for chemoprophylaxis and treatment. It's under this book. So what does chemoprophylaxis mean? Simply means drug use and prevention of malaria infection. Don't want to focus with big grammar. Chloroquine has been the drug of choice for both treatment and chemoprophylaxis since the 1940s against Plasmodium falciparum and other species of human parasite. And chloroquine is a synthetic 4-aminoquinoline formulated as phosphate salt for oral use only. So chloroquine phosphate is just for oral use only, and it belongs to the class of the 4-aminoquinolines. Next slide. So chloroquine indications. Chloroquine is contraindicated in patients with psoriasis and porphyria. It should be avoided in patients with retinal or visual field problem. Psoriasis and porphyria are also eye issues. So patients with any form of eye problem should avoid chloroquine. Patients with the history of liver disease should avoid chloroquine. And anti-diarrhea agents such as kaolin and calcium and magnesium containing antacids, like magnesium trisilicate antacid and many other antacids that contain calcium and magnesium, they interfere with the absorption of chloroquine and they should not be co-administered together. So for ulcer patients taking antacid containing magnesium trisilicate, they should avoid chloroquine. They should not co-administer, don't use it together. The next one is what is therapeutic use for chloroquine is used for chemoprophylaxis and treatment of malaria, as I said. It's safe in pregnancy and it's also used for treatment of malaria in children. Next one, artemisinin and its derivatives. Artemisinin, gingausu, is a sesquiterpene lactose endoperoxide. This gingausu is the active component of an herbal medicine that has been used as an antipyretic. Antipyretic means anti-fever, high temperature. It has been used in China for over 2,000 years now. So artemisinin himself is insoluble and can only be used orally. But along the years, analogs have been synthesized out of this artemisinin to increase solubility and improve anti-malaria efficacy. So the most important of these analogs are artesunate, which is water soluble, can be used orally, intravenously, and intramuscularly, and even for rectal administration. We also have artemether, it's also one of the artemisinin derivatives analogs. This is lipid soluble, also used for oral, intramuscular, and rectal administration. And we also have dihydroartemisinin. This is also water soluble and useful for oral administration through the mouth. The next one is what the WHO, World Health Organization, they recommends 5-artemisinin-based communication, and this artemisinin-based combination is now the standard treatment for malaria. So in nearly all areas, and it is basically 30 days completion dose program. So one of the regimen we have the artemether lumefantrine, the brand name is Coartem, we have Veramet, we also have the artesunate and amodiaquine combination. We can see them in Asac, Acusam, and Quasucam. We also have the artesunate plus mefloquine. We have dadremecin, and piperaquine. We also have artesunate plus sulfadoxine pyrimethamine. So these drugs are the World Health Organization recommended this regimen for the treatment of malaria. So now we are now in the question and answer period. So because we don't want the slide to be broken and want it to be short and sharp, so this question will help. Just have 4 questions basically. So is artemisinin safe during pregnancy? The answer is yes. The World Health Organization recommends artemisinin-based combination therapies for treatment of uncomplicated malaria during the 2nd and 3rd trimester, not first trimester, 2nd and 3rd trimester of pregnancy. That is from the 6th, the first trimester is the first 3 months. So the last month to delivery, the artemisinin are safe. So can chloroquine be used for amoebic liver abscess? Yes, chloroquine reaches a high liver concentration and may be used for amoebic abscess. When metronidazole fails initially for treatment of this amoebic liver abscess, you can take chloroquine to treat the amoebic liver abscess. The next one is, what is the parasitic life cycle of malaria? It starts from when an Anopheles mosquito inoculates Plasmodium sporocytes to initiate human infection. This simply means the Anopheles mosquito, be it the female one to be particular, injects this Plasmodium sporocyte into the bloodstream, and this thing injects it into the bloodstream to create human infection, and it now circulates in the bloodstream. Circulating sporocyte rapidly invade liver cells. So these things enter into the bloodstream, circulating, and they target the liver cells and exoerythrocytic state tissues. So we know the erythrocytes, which is the red blood cells. So exoerythrocytic state tissues means the process of blood outside the liver. Yes, the liver is the major point where liver is being produced, and the kidney too has its own part in it. So all those outside the erythrocytic state in the tissues, the sporocytes invade it. So the schizoids mature in the liver. This schizoid is just the sporocyte that is in the embryotic level inside the liver. So it matures in the liver, and when the schizoid mature, it now becomes a merozoite. So these merozoites are subsequently released from the liver. That is, they are already matured now. They come out from the liver and they invade the erythrocytes, which is the red blood cell. So they invade and cling themselves to the erythrocyte. And this is the one that leads to the pyretic symptoms: the blood, the hotness, the high level, the high temperature, and all that. So the erythrocytic parasites are the ones that cause this clinical illness. And let's not forget, in Plasmodium falciparum and Plasmodium malaria infection, only one cycle of liver cell invasion and multiplication occurs, and liver infection ceases spontaneously in less than 4 weeks. So if there's any treatment of malaria, we are targeting at eliminating this erythrocytic parasite from the bloodstream. The next one is, what are the several drug classification of anti-malaria? We have the tissue schizontide. It's a drug that eliminates developing abdominal liver forms of schizoids. We have the blood schizonticide. This kills out on erythrocytic parasites, so removing the parasites on the red blood cells. We have the gametocyte. They kill the sexual stages of this schizontide transmitted by the Anopheles mosquito to the bloodstream and prevent it from transmission from going back to the mosquito. We also have the prophylactic drugs. This is capable of preventing erythrocytic infections. Special thanks go to the Almighty God who gives us the opportunity. Also, I appreciate my amiable pharmacist Olushola, and my special self of Farm Tech and my attentive audience. Thank you for listening so much. I appreciate it. God bless you. Thank you so much.